DOLA patient-ready orthotics. The orthotics podiatrists use. A collection of our 9 most popular and proven prescriptions developed from over 50 years of clinical and orthotic experience. Patient-specific styles, ready to fit in clinic, orthotics for health professionals only. The Propulsion patient-ready orthotic promotes ankle and forefoot sagittal plane function during gait. This video will help you identify which of your patients will benefit from adding the Propulsion orthotic to their treatment plan. What type of foot will it help? What does it look like and how does it function? What conditions will it help? And why will this patient-ready orthotic help your patients? This foot may show signs and symptoms of impaired sagittal plane function at the ankle and/or first MPJ during gait. Impaired sagittal plane function can occur in all foot types, including the supinated or pes cavus foot, the pronated or flat foot, and even the relatively normal or neutral foot. On assessment, this foot may display some of the following: a reduced non-weight-bearing ankle range of motion, a reduced non-weight-bearing first MPJ range of motion, reduced weight-bearing ankle function, or reduced weight-bearing first MPJ function. On sagittal plane assessment of ankle function, it may display an ankle equinus, or tightening of the posterior structures of the leg, a failed lunge test, and proximal or distal compensations at the knee, hip, subtalar joint, or mid-tarsal joint. On sagittal plane assessment of the forefoot, the foot may display impaired propulsion and windlass function, showing signs of functional Hallux limitus, including avoidance of high gear toe-off with a lateral or low gear toe-off pattern, or proximal compensations. On functional examination of the windlass mechanism with Jack's test, results may include a reduced range of motion compared to non-weight bearing, high force needed for activation, or a delay in initiation. It may also present with many mistimed gait events, including heel lift, prolonged mid-stance, low gear toe-off or lateral toe-off, and impaired propulsion and windlass mechanism. Your patient may present to your clinic with many pathologies relating to their foot posture and function, including various forefoot pathologies, including skin changes or hyperkeratosis, general metatarsalgia or forefoot pain, metatarsal capsulitis, bursitis, neuritis, or neuroma, all relating to the impaired forefoot function in loading, but especially during propulsion or toe-off, combined with muscular imbalance. First MPJ pathologies are also common, including bunions or HAV, the development of Hallux limitus, or sesamoiditis, all relating to forefoot loading, functional Hallux limitus, or forefoot instability. Toe deformities may also indicate impaired forefoot function, including plantar plate injury, claw toes, or retracted toes due to muscular imbalance. Common midfoot pathologies include plantar fascia or medial arch strain, mid-tarsal joint or Lisfranc injuries, cuboid syndrome, midfoot osteoarthritis, first metatarsal cuneiform lipping, or abductor hallucis pathologies, all relating to the sagittal plane foot function, any compensations, foot loading, and increased tissue stress demands beyond tissue capacity. Common rearfoot pathologies include plantar fasciitis or plantar heel pain, symptomatic heel spur, calcaneal apophysitis or severs, otherwise known as children's heel pain, and retrocalcaneal bursitis or Haglund's deformities, relating to the sagittal plane function of the ankle, foot loading, and increased tissue stress demands beyond the tissue capacity. Lower limb and ankle pathologies, including Achilles tendinopathies, soleus or gastroc pathologies, flexor hallucis longus pathology, anterior ankle impingement, extensor tendinopathy, or perineal pathologies, relating to the sagittal plane foot function, any compensations, foot loading, instability, and the increased tissue stress demands beyond the tissue capacity. Due to the proximal chain compensations previously mentioned, the patient may also present with common pathologies affecting the patella or patellofemoral joint, the knee joint, the sacroiliac joint, or lower back. The signs may already be there in your current treatments to give you confidence that the propulsion orthotic will help your patient. Have you had success with taping, arch taping or plantar flexing the first ray? A footwear change to a style with a higher drop? Stretching or strengthening programs? Improved capacity of the pathological tissue or treatment-directed testing of a medial arch pad, 2 to 5 pad or heel raise? Or has your patient had previous insoles? All of these may indicate that a patient-ready propulsion orthotic will be a successful option. So how does the patient-ready propulsion orthotic help my patient? This orthotic design promotes ankle and forefoot sagittal plane function during gait. Stable rearfoot control. The rearfoot platform provides stability for the transition from heel strike to mid-stance during foot loading. The medial arch support provides support for the medial arch for transition from mid-stance into propulsion, improves the windlass activation, forefoot stability, and promotes a high gear toe-off. The lateral arch support stabilizes the foot and promotes the transition from heel strike to toe-off. The moderate heel raise improves sagittal plane transition from mid-stance to propulsion and addresses any ankle equinus. A reverse Morton's extension improves propulsion, activation of the windlass mechanism, and sagittal plane function of the foot. The full-length performance EVA shell provides the combination of cushioning and control needed by this foot, and the luxury DuraFit top cover is designed for both daily and sporting activities. For more options to fix the feet that walk into your clinic every day, see the full patient-ready range and be sure to check out the rest of the training modules. Need help finding the right orthotic for your patient? Use our online orthotic selector tool. Tell us about your patient, their activity level, pathology or lifestyle and performance goals, their foot type, clinical test results, and we will recommend the best patient-ready orthotic from our range. For daily education and training, follow us on social media, including Facebook and Instagram. Subscribe to our YouTube channel, follow us on LinkedIn, or visit dollarorthotics.com.